Is it on go or is it on 3 or is it on 1?
Problematic.
I'm Marquise.
Problematic. Problematic. Look out podcast. Here, Sito in the building. Problematic.
It's your boy Juju.
Problematic. Look out podcast. Problematic.
Yo, what did my man just say then?
Problematic.
Yo, you're listening to Mr. Rock.
Problematic. Cookout podcast.
Yo, what's up, everybody? Welcome back to another episode with the gang. It's your boy Juju in the house.
It's Marquise in the building.
You know where Sito's at.
And Mr. Rock's right here still.
So today we'll speak about the illness that has completely taken over 2020, and let's be honest, it's probably going to rewrite the foreseeable future, the Rona. Let's speak about it. Let's speak facts. Let's speak numbers. Let's speak feelings. So my guys, how have you guys felt because of this fungus in the past few months? Rock, kick us off.
Yeah, I've been scared straight. Like, you know, other people will be out there and just moving around like it's nothing. I've been scared since day one. When I heard this, I really looked into it in terms of the impact that it's going to make. And things like, you know, distances from your family and friends. It's really had an impact on how, you know, I'm living my life and so on. Like, I haven't been here that long. And, you know, I had plans for this summer to make it more interesting, build more relationships and friendships and things like that. Mm-hmm. And now it's kind of like put me back a year. But
yeah,
on the other side of it, I'm still healthy, making sure that I'm keeping my distance and all those things we will talk about later on. But yeah, it's been something that's opened my eyes to many different areas of life. You know, when you just think about viruses in general, like this is a big one at the minute, but there's still many others that are out there that, you know, we take for granted. And, you know, you come home and, you know, not necessarily wash your hands, or you touch this or you touch that and then you wash your hands. But you also got to think about, you know, as soon as you step in the house, what are you bringing in on your shoes, on your clothes? I don't want everyone out there to be like over focused on it, but be focused enough to make sure that you're doing the right thing to, you know, keeping yourself safe. And, you know, that's one of my main things I try and push out and share with everybody. It's not just about your own health, but it's all about other people's health and other people's families and stuff like that. So, yeah. Sido.
Yeah. So when the whole thing first started, to be honest, I think I thought I had it. I don't know. I didn't do testing, to be honest.
Bro, I think everybody went through that at some point.
Everyone has that
this
like
whole
thought,
time we're like, bro, do I have it?
You know, it's hard to like legit be like, oh, maybe I did have it before the tests were like readily available. But for me, it was like I was in 8 different airports in February, and I'm like, there's no way I did not get it. Or I was in Montreal, Toronto, Alaska, Seattle.
You're on the safer side.
I was in all these places.
Mr. Worldwide right here.
Yeah, sir. You know, and I was very sick in those 2 weeks, right? Like. And it was funny because one of the days I was actually working with Jobu, and then me and Jobu went to Charlotte after. And while I was like stupid sick, I still kept going to the bars and just drinking my behind off without any care in the world. So, you know, some of those deaths are probably my fault, my bad. You know, but at first I was like, all right, I survived. Luckily, I was sick, but I wasn't home, so I didn't spread it to my mom. Mom was good. I was like, all right, we straight. Mm-hmm. And then when New York went into lockdown, and it was just like, oh, yeah, this is really real. And then you just see people dropping like flies. This joint got so close. I know at least 8 families or 8 people in families of friends of mine and out of those 8 people that caught it, 5 or 6 of them have died. So even though it's like a 2% death rate, for me it was closer to like 60% death rate. One of those people was my very next door neighbor. Damn. So this joint was like right on my doorstep, and I was like, "Yep, this joint is real. Y'all should better wear your mask." And I was an essential worker. Luckily, you know, everything was locked down. So me being an essential worker, I'm just going into the office. I'm literally by myself. I've probably crossed paths with like 2 or 3 people. So I was a little less worried. But at the same time, it was like this is some real stuff. So I tried to avoid most things up until about May. I'm not personally scared of it. I'm more scared of the consequences. So if I'm not safe, like I said earlier, luckily my mom didn't get sick, and I've done a good job of making sure nothing like that happens to me, and I stay away from her. But if I'm not as diligent as that, who's the next person who's more at risk than me that I spread that joint to? And I'm trying to be as safe and precautious with this thing as much as possible.
Man, I'd say the Rona is there for me, but at the same time, it's not really there because I don't know anyone directly who's got it, or or who's had symptoms or had to go to the hospital or anything like that. So like, I feel like it hits home harder if you do know someone than, or if it hits you like in your family or hits you directly. That's only at that point is when you'll be like, you know what? Oh, this is actually real. Well, for me, I just recently jumped off a flight from the States, so like I'm checking every day just to see if my flight was impacted or not. And then, I'm doing my bit where I'm self-quarantining at home. So like if I, for some reason, end up getting it, then I'll know for sure. Be like, you know what, COVID really is real and the world is hurting.
I hope you had a mask on that whole flight, bro.
Oh, the N95s and everything.
Nice.
Okay. Yo, I'll get them ones with,
Hospital
the big
grade.
things right here.
Yeah.
That'll be me on the flight, man.
People had the whole face shield, everything.
I went
even
to.
the flight,
No, go ahead.
even the flight attendants were like, "Don't even take your mask off. Like, if you plan on eating on this flight, just like take a bite, close the mask, and like chew with your mask on and stuff." Like, it was
still
pretty
serving
serious.
food on the flight?
So they give you water, which is good. They give you water, and like I got like 2 biscuits. That's pretty much it. Like they don't really give you any real food or anything. And on the shorter flights, they don't give you nothing at all.
Yeah.
good.
If he was on my flight, I'd mix those biscuits in with the water and I'm giving you a straw. You better pop that around your mask and sip that biscuit and that water. Man,
It's like, biscuit smoothie. This is delicious. Scrumptious. Oh my lord.
Yeah, but I've been on a few flights, but like they have like honestly they've been just giving out water, and stuff like that. But no, I think that's real though, Marquise. Like, cause I feel like I'm kind of in the same boat where I know it's there somewhere. Personally, I haven't seen like in my direct life like the real negative impacts of it. Right, there's been some people around me that have gotten it, but everyone has recovered, almost like had no symptoms, or it's been like the regular flu. So I still kind of see it as a we can beat it, we can get over it. But the scary part for me, I guess, and where I continue being mindful and careful is just the people that are more at risk that are around, right? Like I visit my cousin almost every week, and she's at risk. My parents, my just wanting to be mindful of that, obviously, at all times. And that's where for me it's the uncertainty there that's been such a weird time. And I think that I'm also on the other side where I also do have quite a bit of compassion for the people that have been impacted on the other side of this, right? That people that have lost their job, the people that can no longer go to work, people that struggle with their mental health through that. And I'm thinking about those people too, because I think that it's so easy to say like, oh well, there's something bigger going on, just get over it. But we don't know what some of these people may be going through, because I found myself like being really lucky during this period. Like it opened some doors for me that it didn't for other people. So I'm just mindful of what kind of period it is for really everyone, and how everyone is dealing with everything. But this being said, one thing that I did mention is that the part that scares me about the virus is the unknown, the what we don't know, right? Like there's so much of that is unknown. Like I was speaking to one of my friends the other day. She was telling me like we don't really know if you can get it more than once, right? So like if you gotten it once and you tested negative for it, is it really gone from your system, right? Like, or like, how can you get it again now, or are you like now immune to it? But let's speak about it from like a fact standpoint, a number standpoint of what we do know about this virus and about what we have right now.
Yeah, so I looked at some of the stats. So we got some worldwide stats and some like highest daily peaks and so on. So like back in September there was like 6,116. July there was 9,000. And this is deaths. Sorry, let me put that out first. This is deaths in a day from a new virus.
Is this globally or?
Yeah, that's globally. Sorry.
Okay.
Yeah. In May we had 6,400, and just at the end of September there was like 4,964, and the highest number of cases in a day is like 408,000 people contracting the virus in one day. That's worldwide. Then we got links to, you know, like new cases in the US and Canada and so on. So total cases worldwide, total cases is 40 million at the minute. Yeah, so worldwide recovered is like 27.8 million. So there's still a lot of people out there that, you know, may not have fully recovered. You know, we talk about the 14 days and so on, but there's people that have long-term illnesses off the back of it.
Yeah.
So, you know, you gotta be cautious and think about that side of it as well. You know, the US is leading at the minute. Closely coming in second place is like India. They're having a big impact right now. Brazil, Russia, Argentina. So cases in the US is 8.28 million.
We're number one. We're number one. Yeah.
One.
Hey, that's what y'all pride yourselves on.
USA.
You know?
USA.
America. America.
Yo, and deaths is 221,000 deaths.
Damn.
You know, since it's, you know, this kicked off early this year.
We're number one.
Bruh,
You
stop.
know? And then, you know, I didn't get the stats for Canada in terms of deaths, but also in the UK, you know, this is really, really small island, but it has a high population of people, right? So cases, they got 763,000 people. I think the country, I need to double check the exact population, but, you know, compared to Canada, there's more people in the UK than there are in Canada, which is a
wild.
crazy thing when you look at the size of the land.
Yeah,
But
the UK is such a tiny
interesting.
country.
yeah, it's overpopulated. That's why, you know, the spread of the virus there is quite high, percentage wise, because people live very, very dense
Right.
there.
Yeah.
Deaths sitting at 43, nearly 44,000 deaths from a new virus on top of all the other viruses that are out there. So, you know, there's ways that we're going to talk about, you know, keeping yourself safe and really thinking about not just yourself, but other people that will be impacted around you. So I don't know, anybody else got any extra stats there?
Yeah, I was able to pull up those stats for Canada specifically, because you know we had 204,000 cases, 172,000 recovered, and 9,794 deaths. So, you know, just to put in kind of perspective, a country, and obviously every country has been handling it a little different, right? But that's from
a statement.
yeah, but like it is, but at the same time, I think that even those numbers, there's so much more that goes into those numbers, right? Because it's interesting. I saw something floating online at some point speaking about here are the deaths that were caused to something else than COVID-19, right? Like, so that had underlying health factors, which we already knew those were the people that would be unfairly affected, right? Like, so that's not a secret. But still, if you look at it from the death toll of people that have contracted it that had no underlying health factors or that were below a certain age, I think it was like below 50 years old, the numbers still look from a case to death standpoint, the numbers do look pretty good. Now, I'm not saying that the other people don't matter, obviously, but it still tells me to some extent that it is a little controllable, right? Like, so that it's, if you know that you're at risk, that you have an underlying health condition or this or that, you can be mindful of yourself. You can take care of yourself. But your thoughts, because I know, Marquis, like, you wanted to speak about how this virus is really different from the flu or whatnot.
I mean, I don't know if you guys have noticed or heard people kind of arguing the point, whereas that the flu occurs, like, we experience the flu season every year, right? But we don't end up we don't end up shutting down cities. We don't end up asking people to, like, put on masks, and all these extreme measures that we have now, right? Although both diseases are pretty similar, they're both respiratory diseases, and the illnesses, they range from asymptomatic to even severe cases to even death, equally, right? And they're both pretty much transmitted the same way: contacts, the water droplets from your mouth. But we don't necessarily treat it the same. The main differences between the two diseases essentially is the speed of transmission.
Exactly, I was gonna say, yeah.
But what's kind of interesting that I noticed off the WHO website is that the flu does spread.
Sorry, I had to add that one in. Sorry, go
Good
ahead.
one. Yeah, so that
Who you talking about?
the man's at the World Health Organization.
Man, them over there. Yeah.
See, America left that organization, so I know nothing about that. We got our funding, so
just like doing your own thing.
we just like, yo, we got this. Dr. Fauci all day. Yeah, represent.
All right, we'll see how that works out. But so they were saying that the flu actually spreads faster than COVID, which was very strange. However, the number of secondary infections coming off an initial infection is higher for COVID. So it's basically, if I have COVID, it's a lot easier or faster for me to spread it to other people as opposed to if I had the flu. So infection rate.
Then how does the flu? Then what do you mean by the flu spreads faster?
So it affects more people. It will affect more people, but in terms of person to person spread, the COVID spreads much more faster than the flu. Like, anybody can get the flu, right? Not necessarily because someone infected them, but when it comes to COVID, like when it comes to the COVID and transmission, it's a lot widespread. Like it's
like the percentage of infections like way higher than
is a lot higher
with the flu. Because with the flu, someone could have had the flu shot, could have been immunized,
they could have still got the flu, right?
And they could still get sick, but their likelihood to spread it to someone else is not as high as COVID is.
Exactly.
Got you. Okay.
That's exactly what it is.
Yeah, that's in what I was reading as well. That like from person to person, that spread, and that's why there's all these measures of keeping 6 feet everywhere, limits into places and all that. So, but that's interesting.
Yeah, and in addition to that, the most people at risk of getting the flu are generally children, pregnant women, elderly people, and generally people with underlying chronic conditions, right? And you see the same thing with COVID, which is mostly the elderly and those with underlying health conditions.
Yeah.
Like, you think we've all noticed that the younger children specifically, and the younger generation, cases haven't really spiked or deaths haven't really occurred. They're more likely to recover. And
the thing is sorry, like if you ever had the flu, if you've really had the flu, trust me, it ain't a thing to have, man.
Yeah,
like,
you don't want to have that.
Yeah, when I really had the flu, like I was thinking about death for a couple of days. That's how bad it was.
Yeah,
I just left home and I actually thought about going back home, even though I didn't want to go home because it was that bad. Now, if that's the flu, and then you got coronavirus, which is another thing that impacts your chest, not just your body aches and your fevers and all that kind of stuff. I couldn't imagine like how easy it is for if you really have it, where you have to be in hospital and have a respirator and all them kind of things.
Yeah,
Like,
because like there's also this thing where a lot of people are saying, oh, if I get it, I can just get over it. And I'm not gonna lie, like I probably have that mindset as well. But then speaking to some of my friends that actually got it, that didn't have a ton of symptoms, but did tell me that months after, they still haven't recovered like their sense of taste, their sense of smell, and there's like some underlying conditions that come with it. And the people that have had the symptoms, it ain't no fun thing to have, right? So a lot of people compare it to like when they get a cold every year, right? Like, you know, the flu and the cold and the little cold that you get every year, those are two completely different things. And now, like you were saying, like you add COVID to that, it ain't as fun as people. So it's easy to say once you haven't gotten it, be like, oh, if I get it, I'll be fine. People. I totally understand that. But yeah, because those death numbers still, they I don't know. I know, because this whole time we heard this whole like, oh, 1% of people die, like less than 1%, all of that. Those numbers ain't looking like less than 1%. Know what I'm saying?
So one's too many, man.
Yeah,
exactly.
Like,
I'm saying
like,
no, for sure, like 1%. That's still a lot, but
yeah,
like those, we're no longer at 1% of the people that get it. So I don't know. We just obviously gotta be careful.
Yeah.
But
and I feel like that's a dangerous number to throw into, like 1%, because if you take 1% of 350 mil, which is I think the approximate population of the U.S., that's still like 350,000 people. Like that. That is a high number. Like you don't want that that number to reach. But well, we're well on our way. So it's
it's like 1 out of every 100 friends that you have.
Yeah,
exactly.
right.
You know what I mean? Yeah.
No,
like I
crazy.
said, for me, it's like 60%. So
That's true.
And what do you guys think about what has caused the numbers to rise consistently in North America, while I look at some of the other countries in the world that have started return to normality? What are your thoughts on that?
I'd say I think firstly, one thing we gotta consider is that the amount of tests that are being done has increased compared to the initial onset. So a lot more people are getting tested now. I know in the US it's free to get a test. In Canada, in most places, it's free. I mean, and I'm pretty sure there's some clinics where they actually charge you. I don't know why, but I think it should be free for everybody.
They be taxing in Canada, bro.
Is there a reason why? Does anybody know?
I don't know. I don't understand, but like there's some places, man. Like I've heard of like $160 to take the test.
Bruh, I feel like that's discouraging. I'd probably just want to stay home at that point.
I'm gonna keep this 160 in my pocket, and I'm gonna beat the virus in 2 weeks. I'm gonna be all right.
I'll be back in 2 weeks to check the outcome. But I mean, I think that definitely inflates the numbers a little bit, because technically those numbers could have been that high regardless. It's just that not enough people were tested at the onset.
Yeah.
And then the second point, I'd say, I think we can all agree, just the loosened restrictions after the first wave, where a lot of people were congregating and not observing social distancing restrictions, that definitely contributed to the increase in infections. And I know this is a fact because I always be seeing people on IG posting stories. They be hanging out, they be chilling, doing whatever. But I don't see any hand sanitizer on the table or any Lysol wipes next to those shot glasses. So I'm sure they're definitely not doing their thing. You know what I mean? But
bro, like the US got full on clubs open. I'm talking about like girls twerking all over you, sweating all over you, like, bro.
It's great.
How you know that, bro?
America, baby.
Sweating all over you, huh?
I was showing in my IG live the other day. That's what happened.
Oh, okay. Sid, come on, you know better than that. You know better than that, Sid.
I've been chilling, man.
Yeah, we playing, y'all. We're playing.
I don't be in the club, guys. I don't be in the club. Not during Rona.
But yeah, Marquise, you were saying.
Yeah, no, I would just say, like, I mean, regardless of all the above, I think we still need more data. We still need more information on what's going on in order to determine how bad the situation really is. You know, and I think all we can do now is kind of just wait and do our part and just see what happens.
Yeah, for me, there's two things. The first thing is ignorance, right? This is a new virus. We have no idea the side effects. We have no idea the full-on side effects. You know, in the early days, we didn't know even how it was infecting people, how high the transmission rate and things like that were. And then all the scientists said, you got to do X, Y, and Z. And half the world was just like, forget y'all ain't talking about shit right now. And the other half was really willing to listen and, you know, adhere to the rules that are suggested by scientists, who it's their literal job to figure this stuff out, right? And once you don't want to believe the scientists, like, there's so many bad movies when the scientist says something and the whole movie goes to crap because they ain't listen to him.
Yeah.
Like, just listen to the scientists. They literally, their life's work is research and, you know, scientific method to figure out the best way to do something or solve something or, you know, help somebody. Just take their advice. And then after that, we got the doctors and the nurses who are the frontline workers. You know, God bless. Thank you guys very much for all the work that you've done. But all that stuff that they're saying, like, hey, look, the scientists said XYZ and we're dealing with XYZ as a result. Like, please quarantine, right? So when it comes down to that, and then you have the people that want to just fight the chance and just be on that, right on the edge, like, yep, I still want to live my life. This is ruining my life and I'm still going to be me. Those are the people that spread this thing the worst, and those are the people that also cause the most, like, damage. And I think that's a high reason for the numbers. The second thing for me is that people are just generally nasty in public in general. Like, you got people using the bathroom, taking a whole dump, walk out the bathroom, not wash their hands.
Bruh.
Like, this is like all that little disgusting stuff that happens all the time. Because, like, for me, when I used to take the train to work, you know, I take out we got a Metro card. That's our pass. You know, you swipe it, you get on the train. There's always a homeless person on the train. And sometimes you'll have whole, like, train carts emptied because the homeless person is in there and he, like, pooed himself and it smells terrible. Right. And, you know, New York never really did a great job at cleaning and sanitizing the trains like that before COVID. So anytime you took the train and you got to work, whenever I got to work, the first thing I did at least was use hand sanitizer. Most of the time it's me going full on in the bathroom and washing my hands. But before I, like, take out a laptop, touch my computer, do anything, sanitize. And if I go out to eat, trying to have hand sanitizer on me, I'm disappointed if I don't have sanitizer, and I'll actually go to the bathroom, wash my hands before I eat and stuff.
Sid,
there's a lot of people.
It's funny that you mentioned that, because I bet you a lot of people end up going to McDonald's on a random night. They've been outside, they've been opening doors, they've been touching everything, and then they'll go to McDonald's, grab the little burger, and just go right to eating. Nobody, I'm guilty of that. I like,
eating the chicken nuggets.
You know what I mean? Like, we don't even go. You don't even go to the washroom. You be touching the burger, you touch the fries,
finger licking
everything.
good chicken, all that stuff. You know, on a drunk night, and that's even the worst time to do it, when it's a late night. You coming from the club and you just, like, wasted and you just
you're not gonna remember.
You're not gonna remember that. And all these clubs that are open now, these people are going through the same thing. They probably enter the club, I'm gonna be a little COVID prepared, and at the end of the night, whoa, drinking, taking shots, licking up this person, this and that. All these people are dirty, bro. They're dirty. Like, some people don't have it's like hygiene should be a class in some form of education, despite like kindergarten, when you just, like, learn how to wipe your butt. You got to learn how to wash your hands. You got to learn how to, you know, shower correctly. A lot of people don't do any of this stuff. regularly, and then COVID came, and then the rules were basically like wash your hands, don't touch your face, and everyone was like, oh my god, I can't believe that's like stopping the spread, it's got to be fake. It's like, no, you're just a dirty, nasty person that don't know how to do this stuff regularly, right? So my opinion, we got to do better with the hygiene, like especially to family members. Like sometimes like, oh yeah, this is my brother or my son or whatever, and then you do something that swap some kind of bodily fluid on like a spoon or a cup.
Yeah, we go dapper.
Yeah, I be fist pumping. Like that's it. But you know, it's basic stuff like that can help to stop the spread, because we don't know where COVID is. It could be right on my table, but you know.
But that can't be, like, I'm saying, like, people are nasty in general. That can't be only like around here in North America and stuff. Like, it's, I don't know. What are your thoughts, guys, like, on why North America like has been maybe like rock? Like, I don't know if you have something to say about like why North America has been like weirdly impacted more, like North America and the UK. The UK also has seen quite a spike in the past few months.
People are quite ignorant, and you know they're looking for any excuse to give them a reason not to do something. So you hear the scientists telling people, make sure you do this, cover your face, you know, wash your hands, keep your distance and stuff like that. So you hear that from the scientists who know the real deal, right? And they're told this every day. But then they sit around waiting for someone from the government to say what you should be doing. Now this governmental person is not a scientist, but people looking up to presidents, looking up to
world leaders,
you know, looking up to all these people to tell them what to do. Like when you were growing up as a child, your parents told you should do this, you should do that for these reasons, right? So you know within yourself, when I go outside, I should keep my distance. You know, I shouldn't congregate. You know, like when you were a kid, you know, your parents told you not to congregate around, you know, groups of people because you might look like a gang to the police or whoever. So, you know, you had to be on your guard and make sure when you're in certain environments that you protected yourself. But I think now people are so lazy, like, you know, they'll see someone in that position of power in the government and think, okay, I'll follow what this person's doing. But, you know, this person has access to all these medical treatments and, you know, all this support and whatnot. And you're just a lot of people are just a normal human being. Like, you don't have that, you know, that high level of healthcare and, you know, someone to fly you over in a chopper to the hospital. So I think, you know, people need to be really focused on what they know within inside themselves and not sit around waiting for someone to tell them to do something. And on the back of that, it's, you know, it's something new for a lot of generations to have to go through something like this. You know, we've had other diseases that have been out there, but, you know, they haven't impacted us as much as this has. So you got to a point where people were getting a bit tired of having to stay in the house and not go and do this and not doing that. And the sun came out and people were like, oh, well, I can just go to the park. And then, you know, from the park, oh, we're having a party over here. And then people start to move around and become extra relaxed. And, you know, before you know it, you're congregated in spaces without a mask with a group of people. And, you know, I know for a lot of people, they can be like, well, I'm already here now. So if I've got it, I've got it. So I'm continue to party or whatnot. And I think the realization for those people is when it impacts someone close to them. And knowing if they were in a position to be like, you know, I could have passed that onto that person, you know, that would probably be the worst feeling, to know that you've passed a disease to somebody else close to you because you haven't kept your distance and kept your safety. So I think that's, you know, one of the main points that people should be really looking at. You know, I know it's been months and months that we've had to deal with this, but at the same time, you know, you got to look to the future. You got to look to where you want to be. You want to look to where your family and your friends are going to be in the future, and not impacted by this as much. But then there's the other side of it where people got to go to work and got to be out there. So, you know, it's a fine line, and we also have to, you know, be thinking about those people that work in the hospitals that have to take on this pressure.
Yep.
you know. And I think a lot of times these people are like ignored, like, oh, it's just their job. But no, if you gotta work around, you know, an environment like that where they're seeing people, you know, struggling for their lives and people dying every day from a virus, and then they're seeing people out there just, oh, willy-nilly, I'm gonna go to the party, I'm gonna do this, I'm gonna do that, you know, it's not a good thing.
And then they gotta go home to their family.
Spread it with their family. Their family die from it. It was like,
Exactly.
you motherfucker, just because you wanted
You
a
know?
Jack and Coke at the club and you got it.
Yeah.
Yeah.
So, yeah.
No, I think that's real, man, and I think that it's a little bit that everybody has their own rules, right? And everybody wants to, like, oh, like, no, this is how it should be handled, and this is how it should be handled, and it's that pride in every single one of us that, like, we just know better. Oh, I just pulled up this number, so this number, you know, this statistics says this and that. So there's no issue, just reopen everything. But I think that even on the other hand, I think that there's so much, I think, uncertainty that everyone's just trying stuff. Like, I was looking at here in Canada, recently, in Ontario, recently we just closed up all, they just closed up all indoor dining and gyms. And I'm like,
Oh, they closed the gyms, bro.
yeah, but I'm like, why are we doing this? And I'm saying, like there's no statistics that that is back behind. Like, gyms have been one of the safest area, right? Like, they've been like they've been completely revamping. There's only a certain amount of people like allowed in the gyms, things like that. So people are also just panicking and just being like, oh, let's just close something, right? But yet our schools are still open, with the kids that go around playing the dirt together, kiss each other on the mouth and all that, and then go home to their parents. Like,
I think
so,
there's a social side of that, though, right? For young people that, you know,
oh no, for
being-
sure,
not
for
being
sure.
at school.
Oh no, for sure. Like, there is, but I think that there's a social side. Like, if you think about the mental health of adults too, like, are we going to now say that we don't care about, you know, we don't care about them? And like physical health, like, there's, you know, scientific proof that having better physical health is going to help boost your immune system. So there's just a lot of just trying stuff and throwing stuff out there, like, oh, let's just lock this down, and even like the dining, okay, I get that a little bit more. Closing bars, closing the restaurants, I get that a little more. But I'm also like, if you know that you're a little more at risk, don't go out to a restaurant. You know that you could, you know, you have just as many chance of catching it by going to a restaurant than by going to the grocery store. But are we going to shut down grocery stores now?
Nope.
So
we ain't.
I'm just like,
Yeah,
we're
but
just throwing stuff.
Necessities, though, right? Like, I know that going to, like, this year, we've been out probably 2 or 3 times, you know, and there've been places that have reduced the amount of people that can come, and also it's been outdoor dining, so we've been at a distance. But, you know, in the same amount of time, I would have gone out like 10 times as much as that. But it's like just knowing that potentially, if there's a large crowds and a lot of people out, like when they first lifted the certain levels for the city, I went downtown just to pick up some food from a takeaway, and the amount of people that were on the road, no masks on, you know, acting like this is the best summer ever, and, you know, out and about, and I was disgusted personally that people were just going on with life like
the thing.
normal.
But that's the other thing, though, is that public health has also said that, you know, you don't need to wear a mask outside when you hang out outside, as long as you're not, you know, in close contact, less than 6 feet with somebody else for 15 minutes uninterrupted. But people just decide to like ignore that, and they're like, oh, like, no, like, my rules, you know, according to me, no one should be out, no one should be this. So I understand that people, you know, we want to stay safe, we want to do this, but people are dealing with different realities as well, you know what I'm saying?
Isn't the 15 minutes like an increased, because it's not going to take you 15 minutes of taking someone's breath in to catch something, just like the flu or, you know, any other disease out there. It's not necessarily it takes 15 minutes.
Every
for that
person
to absorb into your body.
every person that I've known that has gotten it, they had a document. So it happened with one of my friends recently. They got a document that said, you should speak to any person who you've been with inside and has been at close range of for less than 15 minutes. And even for us, when that happened, a lot of people were like, okay, well, you don't need to be tested unless you were inside at less than 6 feet without a mask for 15 minutes uninterrupted with this person. And everybody ran to get tested, and everyone tested negative. Now that's a spot that could have been for somebody else that like people just took away because they're like, no, I know that, like, you know, my rules, I need to, like, I'm just gonna do it my way. So I'm not saying that all of that is the issue, but I think that on both sides, everybody is coming up with their individual rules of how this thing should be done without no like scientific backing or anything like that.
At the same time though, don't you feel like you guys want to protect yourself as much as possible, even if we don't have the
Hell
answers,
yeah.
we don't have these, like, we don't have the facts to back it up yet. Like, I just had my brother just had a wedding last week, and at the wedding he decided to have it outside because he just didn't want to have it inside. There's just too many risks, and the amount of people he could invite was limited, obviously. So he had it outside. He had everybody social distance, even us as I was a groomsman, so we all had masks on at the front and everything. Maybe he didn't have to do all that because it was outside, but why not just take the extra step? Like, even if it doesn't matter, it doesn't hurt to just do it.
No, but that's what I'm saying. Like, let's just do the necessary to keep each other safe, but you know, let's not stop everyone from living. Let's not, you know, like when there are rules that are in place that are like, okay, yeah, you can't do this, but you can do that. Let's not be like, oh no, we're gonna shut that down too. If there is scientific backing behind, you know, that. But I also want to talk about that a little bit and some of the preventative methods that our health authorities like have put forward to protect people, and how they've become so controversial, right? Like, so examples: wearing a mask, social distancing, not going here and there. Because what I found is that there's definitely a lot of them, and it's got to a point where you're kind of confused where I don't know, you don't exactly know what to do, what you can do, what you can't. But then at the same time, you see the rules, and then people are still upset at the rules. And when I look at the clear cut rules, right, just wear a mask, keep 6 feet, don't have a certain amount in a restaurant, which have been pretty successful. And then people are getting upset at that. But yeah, see me, I got my mask here, right? And I'm not even crazy about like this whole virus, because I don't think that I'm necessarily at a huge risk, but I'll still wear my mask. When I go out, I'll still social distancing. And personally, I've actually enjoyed it, because I'm the type, like when Sido was talking about earlier about everything, people being dirty, I've always recognized that, and I don't like touching people in the first place. So I always hated being in the mall, walking around, and people touching me, being all over me. You know what I'm saying? Like they're right behind me and all that. So I've actually enjoyed, some of these measures that are taking place. So only having a few people in the store, only having this, not having to touch people, not having to shake hands with folks all the time. I actually love it. So those things are cool, but I just don't understand why they're so controversial, because my mask, it's annoying. But every time I hop on the subway, every time I walk in the store, I throw my mask on, and then I walk out, I take it off, and it's no big deal. So let me know, like, y'all thoughts about why people have added out so much against, the masks and the some of the preventative measures that have been like so small.
So yeah, as the American in the group, I just have to say that these social distancing rules and putting on my mask are a violation of my rights as an American. All right, my freedom of speech. Who are you to tell me that I have to put a mask on to walk into an establishment? Who are you to tell me that I have to stay home, and when I should be able to go wherever I goddamn please? That's a big deal in the States right now. Everyone thinks it's some kind of violation of their rights, despite us trying to save ourselves from ourselves. Any kind of draconian measures like that, like lockdown and quarantine, just do not mesh well with the American public. I don't know why that's the case. Anytime you tell an American to do something, even for the betterment of themselves, they're ready to fight you, whether it be seatbelt, certain way to build a house, collecting rainwater, now masks, and at
Yeah,
lockdown.
y'all always got something.
It's always, and then it's so easy to just throw a conspiracy in there like, oh, they want us to social distance so they could scan our faces better.
5G,
but we got
5G.
masks on. 5G. Oh, the 5G. That had me livid, man. I couldn't believe that stuff. But a lot of it in the States is, we've been in lockdown since March. That's a very long time to just be with your family and your loved ones every single day. You don't get to interact with other people. You don't get to blow off steam. And that mental health portion has taken a big toll. And then that just ties back into the whole violation of our rights to do whatever the hell we want to and please to. So I think that's the main thing from the stateside perspective of things. What do you think, Rock?
Yeah, the mask thing, it's a must. Like, no one can come near me without a mask now. Like, I would say during the early stages, I was one of the first people to be getting on the GO train with a mask on. People were looking at me like, what's this guy doing or whatnot? This is when everyone was moving around still. Yeah. Who's this guy? Who's this black guy?
Trying to be a ninja, man? What's happening?
You know what I mean? But I always put my mask on. I didn't really care what anybody else thought. I always thought about like getting the goggles and everything because they say you can get it in your eyes as well. Yeah. So it's not just breathing in. You can, any orifice that enters your body, you can contract the virus and stuff like that. So even out and about, walking on the street, I'll do stuff like, people walking past me, if they're walking too close and didn't have a mask on at the time, then I hold my breath, getting past them and pushing the air out and stuff like that. But, the main thing is, just making sure, we're, following the rules that I've set. And when we say the rules, people don't really like to follow rules, but if it's going to impact your life and others, maybe we should just make sure we're following those guidelines. And one of the main points off the back of this, I'll probably say, is the fact that, like, in the early stages, because I knew how important, masks were, from Dr. Fauci and all those other doctors talked about it. And I thought, this is a great time for me to, start up a side business, which I did with one of my business partners. So we started a company called Mask House Co. And so we sell masks, plain black masks, as you can see right here. I'm just promoting the product.
Shameless plug.
Yeah,
drop the link. I need to get me one of those.
You gotta get in there. Look at the side of the back. Let me make sure it's in shot.
Yeah,
so we don't see it. Yeah.
That boy been promoting all episodes.
I peeped it. I was like, is he about to drop this bad boy in there?
Yeah. But, off the back of that, we've been able to go out there and do some interesting stuff and work with some different people and some organizations. So, out of every 200 masks that we sell, we donate $120 to an organization called ITMAS, which is a charity that, focuses on making sure underprivileged families and young people that don't get meals. So say, for instance, after school, some young people may only get a real meal at school. But this organization focuses on making sure that these young people are fed during the week, but also on the weekend. So off the back of this, even though, COVID has been quite negative, I just feel like we've entered into it where we're able to contribute to the lives of other people that need the charity, but also making sure everyone's protected out there. So, our masks are like 3 layers. You can also put an extra piece of screen inside there, so you're protecting yourself even more. But the mask is the number one thing. And, I've gotten to a point where I've got quite comfortable in certain environments. And, I've dropped my guard slightly. And then off the back of that, it's made me then think really deeply about, what I did. And I kind of felt like, in a sense, like I cheated. It's weird. It's so weird, the fact that, I got caught out being around in an environment, which I found out later on someone actually had the virus. So, You know, I made sure that I got tested. I made sure my partner got tested. Even though I wasn't really close with the person at that time, I still felt a need to make sure that we were okay because, you know, my partner has family members and friends that also have, you know, older generation people that could be really affected if one of us did get it and pass it to someone else. So, you know, we really stay focused on making sure that, you know, we're protecting not just ourselves but other people.
Yeah. To jump back in, I feel like if anyone makes you feel bad for taking all the preventative measures you want to take, do not talk with that person again. Like, no one should make anyone feel better. We don't know enough about this, so any preventative measure that you can take, if you feel like you've caught it, you should absolutely take. All right?
On me, I'm like, do whatever you want, but bro, I'm gonna do what I need to protect my family. You know what I'm saying?
Facts.
Yeah.
You could be inside. That joint spreads in the HVAC AC system, blows on top of a whole bunch of people. That is very possible. That has probably happened several times before lockdown happened. So any precaution you need to take, by all means, take it, and you should be confident in taking those precautions necessary. So you keep you and your loved ones safe.
I think there's another thing I want to add into that, because I think as time has gone by, it's been hard to actually ask somebody to, you know, back up. Can you give me a bit more distance? Can you put your mask on around me? Yeah. You know, because you kind of feel like you're telling that person that you might have it. Well, at the end of the day, it's a protection from both sides. But if someone had told me, oh, can you move back a bit? I might be a little bit like, you know, I've had deliveries come to the house and the delivery guy just backs up and I'm like, hold on. But then I'm like, well, he's got a family at home. He doesn't know me like that. He doesn't know what I'm doing.
Exactly.
You know, he doesn't know my friend and what they're doing. So, you know, I think what I want to highlight is that we need to be a bit more comfortable and accepting of people's personal space. And if they ask you to put a mask on, or if you come over here, or, you know, and be more vocal about it, and just know within yourself that you're doing it for the reasons to support your family members, regardless that you're thinking of that person as well. Your main focus is you and your family. So, you know, I think as long as we put that in front of things, like anyone that has a problem with it, really, you know, they got a problem with themselves at the end of the day. You know?
That's true.
Hey, Rob, we gonna need to put the link to that mask website. You got a website or something, so we can put the link in the description. Yeah,
so it's Mask House Co. You know, you can get packs of masks, you can get multiple masks, you can get single masks. All the masks that we sell are all black. So, you know, black goes with everything, but also, you know, in the corporate environment, you haven't got to think about like matching it up with this and that. So it's quite simple, straight in the packet, put it on your face, do what you got to do, protect yourself, protect others. And, you know, as we say, you know, mask up. Yep.
All right. Can they sponsor the next episode that we throw out on the Problematic Podcast? I'm just saying, man.
Well, if you were a charity, then yeah, we'd sponsor you.
This man want to take the money away from the kids, man. Come on, you talking about giving money to the kids?
I didn't say you have to stop that. Just, you know, throw a little love since we made some advertising, bro. You plugged you in, bro.
Hey, you never know, man. We might add in a little discount if you put
a little promo code.
A problematic cookout. Put it in a promo code and then see what you get.
Right.
Yeah. We'll hook up our listeners to something. Yeah.
Yes, sir.
Yeah, we're gonna think about it between now and the time the episode actually dropped. But Marquise, your thoughts on this whole ordeal and people being so reluctant to actually stay safe?
Man, I had a question for you guys.
This man always want to answer a question with a question, bro.
I always got to deflect, bro. I was about to say, I don't know how y'all feel about this, but whenever you have the mask on and, like, you know, let's say you have it on all day, sometimes my ears end up hurting. Like, you know, the back of your ears, like, it just hurts. Like, especially, like, let's say you're on a long flight somewhere and you got to wear it the entire time. Like, my ears be hurting. And I feel like some people just feel that discomfort and they're like, why am I putting myself through this? Like
Because they got the wrong masks. Get one of our masks.
That's why we got the solution from.
Do you all day 9 to 5 and the extra hours after
oh
that.
man, I should have hit you up before I got on that flight because at the end of this flight, man, my ears are burning and I'm like, this is uncomfortable, but I still gotta do it.
I saw this one meme on the gram, and it said like it had the person like with their mask on, their sunglasses, their headphones, and their earrings, and it was like if your ears could talk to you, they'd be asking, "You want me to hold your purse too?" Like you got me holding all this stuff.
For real.
No, I get that. I mean, like it's a discomfort, but if you think about how small that discomfort is,
exactly,
right? It's not like it's really like hindering.
Yeah.
But you guys know anyone that like has had it, that has like gone through it? Like I know we spoke about it a little bit, but
yeah. So like I mentioned earlier, I know like 8 people who had it and their families. One is a close friend of mine. She was like, "Oh, I think I got it," because her mom was like some kind of nurse in the healthcare field. She wasn't like, I don't think she was frontline like COVID nurse, but she is in some kind of healthcare. Whether I think she was helping like elderly people or something. I don't remember too much, but basically, her mom got it, brought it home, infected her and her dad. They weren't properly social distancing from each other because my friend was from her parents, but her parents weren't social distancing from each other because they just love each other that hard, right? And they were like really, really sick. Like homegirl was like, "Yo, I'm coughing. I can't sleep at night. Like I'm up probably like 22 hours out of the day just coughing. Drinking all this tea, doing this, doing that." Like she was really going through it, and for people to say that they got out of it in like 2-3 days, she's like, that's absolute nonsense. They never had the virus in the first place because she was really sick for like, it wasn't just 2 weeks, it was like 3 weeks that she was just continuously coughing and like phlegm and blah blah blah. I know some other guy who was on Instagram. I follow him on Instagram. I used to work with him on a friend's YouTube video, and he actually was in the hospital, and he documented the whole thing, had it on Instagram, and he was like really, really sick. Luckily, he didn't get to the point where he needed to be strap a ventilator on him, but he was very, very public about everything he was going through. And those first 2 instances right there were enough to be like, yeah, this is some real
this is serious, yeah.
And like I said, my neighbor, he caught it. He actually worked in the same area in Financial District, New York City. I think he worked at the World Trade Center, and our office is downtown not by the World Trade, but like a few blocks over. So me and him were definitely on the train together. Well, not together, but like we took the same route to work, and he caught it, and he was feeling really bad. He was feeling really sick. He's like, "Yo, I think I need to go to the hospital." So then my buddy drove him to the hospital, and we got the call that he died, and we were just like, damn. Like he was on the ventilator and everything, and he died back in May. So this some serious symptoms that go on. It's like when you go on the respirator, it's like you're already like very oh my god,
you're in
the deep end.
In it.
You're very deep in it, and it's not looking good from there on out. And the guy who died, he was in his like mid-50s. He didn't really have any underlying causes. Like his health was like, he wasn't the best shape, but it's not like he had like diabetes or like lung cancer or something like that to exacerbate the effects of the virus. He was at high risk, but he was the least of the high risk, and he died. So R.I.P. Aaron. Hope you're all right up there. But
that's why I think that people just got to. I think that people just got to be mindful of like experiences too, right? Like you can give me all the stats, all the numbers you want, but like if I actually know my damn neighbor that died of the thing, definitely I'm gonna have a different experience with it than like
Yep.
you that don't know anyone that caught it. So don't tell me it's not real, it's a hoax, it's this, when you know, I used to have a next door neighbor and now I don't. So
Yeah.
it's yeah. Now what about y'all, Rock Marquis?
Yeah, these. I just want to add on to that. You know, the respirator side of it. You know, people like, you know, you can get on a respirator and bring you back and stuff like that. But that can cause extra damage to, you know, people's lungs, infections, and all those kind of things as well. So there's there's COVID, and then being hospitalized, and then other infections that are around there. And then, you know, a lot of the statistics, if you're going for COVID and you die from something else, they kind of attribute it to COVID anyway.
Yeah, it's still COVID's
So,
fault.
Yeah, so you know, there's still those numbers that connected to other things that you can pick up or whatnot. Yeah, well, I haven't known anybody like directly in terms of, you know, people that I see on a day-to-day basis like that. I've been around in an environment where, you know, I've got to know that someone had the virus, and, you know, as I said earlier on, I wanted to make sure I quarantined for 14 days, stayed away from everybody, didn't go out, and actually went and got tested. Even the testing process, you know, there's two different types of tests. There's one that can go straight down the back of your nose and then like in your windpipe, and there's another one where they just go around the inner part of your nose. So there's one invasive, and then the other one is externally. And I think they're done for two different reasons. And I think in terms of like the turnaround in the diagnosis, I think, you know, if the invasive one is quicker than the other one, I think that's the difference. But it's still not a nice thing to have to do, to go and get tested for anything in life.
Well, one more thing there,
You know?
Rock. Is it also true that the one that goes deeper in is more accurate than the one that's right on here, just on the outside?
Yeah, I'm not 100% sure. I would assume so.
Okay.
I would assume so. But I think there's different tests that you need for different reasons. So, and then depends on how much you pay for the test as well,
Right.
off the back of that. So I know certain friends and family that have, you know, contracted it. You know, I know a couple of families that are going through it right now. I've had, you know, family member that has had it. His girlfriend had it as well, and they had two different experiences. You know, one of them was really, really sick, super sick, and then the other person just lost their smell. You know, one morning, you know, they said they couldn't smell something, and it was weird because this, you know, particular aftershave or whatever they were using is really potent, and they said they couldn't smell it. But then that was the only impact that they had. They lost their smell and they lost their taste. Whereas the other person in the relationship really got impacted. So, you know, we don't really know why, but, you know, it can go from one extreme to another. And the thing is, you could be the one that's carrying, you know, no symptoms or anything like that, but then you pass it to someone who gets the extreme of it.
Yeah.
So, you know, something that we really need to be cautious of, because like with the flu, you either know you got the flu or you don't have the flu. You know, there's no real in between if you're carrying it, from what I know. So you can kind of stay away from someone if you know you got the flu, you got the sniffles, you got the aches and all them kind of things there. Whereas, you know, coronavirus can go across like undetected visually and symptoms wise. So yeah.
Well, anyway, guys, like, yeah, this is a weird time. And I guess, I don't know from you guys' perspective if there's ever going to be a going back to normal, because I feel like there's a lot of measures that this has brought, like, you know, for me, like going to the store, things like the measures that they put in place, I think that it should stay like that, right? It'd be nice to get back to traveling and things like that, but at what point do you guys think we're going back to normal? Like, what needs to happen? What's the solution? You know, do you guys think, like, I don't know, vaccines, or like we just wear masks forever, we just social distance forever? Like, how do you guys think we get back to some kind of normality in our lives? Like, what's quickly, 1 minute, how would y'all do it?
Yeah, for me, I think the rapid testing. So regardless of, you know, the vaccine, everyone's talking about the vaccine. like the rapid testing, being able to test somebody and know if they've got it in 20 minutes is going to be, for me, I think the biggest thing to reduce the spread of this disease. The vaccine is only going to work to a certain percent, whereas the testing is probably a higher chance of understanding and knowing that you've got it. So I think that's for me the key thing. So when it comes to traveling, for example, you get on the plane, if everyone's tested 20 minutes, then you can board. At least you're not spreading that around the world. And even in work environments, in party environments, we could test before going into the club for COVID-19, and then people can go in there and do what they need to do, as long as they're not getting that backdoor entrance, So I think that's the key for me is, the rapid testing.
But you think that a lot of stores that I go into, they just be taking your temperature. You think like that is somewhat of the rapid? Like I know like that's just like your temperature. You could just have a fever, but could that be somewhat some of that? Or
I think it might have a certain percentage of that might be helpful. Because people could be coming in with anything. Yeah. Like I said, there's people that don't show any symptoms at all, no fevers, no sweats. So,
but I mean,
I guess it's partially, making people feel more safe and protected, knowing that these people are here taking temperatures, and people be like, oh yeah, I'll go into that safe store. You know what I mean?
Yeah. But that's what they be doing on flights now, though. They just be checking your temperature, and yeah. That's all they test.
See, but the thing is, if you are asymptomatic and you have it with you, but you have your mask on, at least you prevent the spread of you spreading it to other people. True. So that's a big part of the whole mask reasoning. So
yeah, but Marquise, your take on the solution?
I think we need a little more time to collect more data on this. Do you guys remember when this started? Maybe I think it started in China around September last year. I think we're about at a year now, a little bit over a year, but I still think there's too many unknowns that we just don't know yet. And we need time. The people need time to figure it out. The scientists need time to,
for sure,
do whatever tests they need to do, so we can see what's the best way to move forward. And I think it's them who are going to be telling us what we're going to be doing and what steps we're going to be taking, to be honest.
But most people ain't listening to the government.
That's the problem.
And even then, they're not listening to it.
Sido, what's your take?
Yeah. For me, it's we need a big hope at the beginning of all of this was herd immunity, and now we realize that was a bit of a faux pas because there's like several different strands. I know my nurse friends have told me of patients that they've had that have caught it like 3 times, and they're like in the hospital sick multiple times, right? So if we really want to reopen everything as a society, not only do we need to do masks, we need treatment, not necessarily a vaccine, although a vaccine is probably the silver bullet we need to get out of it. But if we can get some kind of treatment to the point where you can buy it over the counter at a drugstore, your Rexall or your Duane Reade or something, like a pack of Tylenol, and it'll reverse the effects COVID is having on you, then when we have that is when we could start really lifting the precautions. But until we have that, we have to take precautions everywhere else. So if you want to have some kind of gathering in a building, you need to have HVAC systems with like the highest grade HEPA filter. And if that joint is too expensive for you, then your venue should not be on the list of open venues. That goes for schools, that goes for gyms, that goes, hospitals, they probably have it already. But for anywhere there's going to be a mass congregation of people, you need some HVAC filtering. Everyone needs to wear a mask, 6 feet or whatever the requirement is. Those need to consistently be met. We need to make innovations in masks. I think a few months ago in like August, there were about 350 million masks sold through Etsy alone. But for the most part, they're all kind of like basic. Maybe they have a filter, maybe not. If we can get like some kind of crazy lightweight technology in the mask code that just like definitely blocks COVID. And if it goes on COVID, it like sanitizes the front. I'm pointing at you, Rock. Maybe you could put this in mask code and become a millionaire.
Let's get it.
If we
Version
could,
2 coming soon, man.
you know, if we could get to a point where we can do a better job of detecting it with rapid testing, but also like anything that we do also eliminates the virus, like, you know, repeatedly washing hands, cleaning services, self-sanitizing services, all of these kind of like problem areas where, you know, the virus can spread. All the precautions that can limit the spread need to be taken in order for us to like really go forward. And then once we get that Tylenol pill, I think we'll be good.
Yeah, I think that we should. There's still so much unknown. I think that the precautionary measures, you know, like wearing a mask, you know, social distancing, like for like really encouraging the, like, I think that there should be more encouraging people to like be healthy in life, you know, like work out more, you know, eat healthy. Like that should be what we should be pushing, like build that immune system. But also, like you guys were saying, just like continue encouraging people to wash their hands and things like that. I think those things are going to continue being super important. But as far as a solution, I still think it's so early. Like Marquis said, I think that we need so much more, you know, medical advancement. We need more research from the scientists for them to actually tell us, you know, what's going on with this. You know, are you immune to it once you get it once? Are you this? Are you that? You know, like we need some clear cut of those answers before we will really jump to anything else. But you know what, we want to take us. What's that?
I was gonna say everyone should just stay at home. I tell you the truth, the only place I like to go is to the mall and home. I love being at home. So for me, like, this is just kind of like, this is the greatest thing. Apart from
lucky you, I hate being home. So
oh, me, like I was gonna say that's easy for you to say.
We're already on two sides of the coin here, brother.
Yeah, if I can get on my bike and go riding, I don't have to socialize with nobody or go for a drive.
I'm gonna hit you up in about a month. I'm gonna hit you up in about a month and talk about you going on your bike.
Trust me.
Once that snows out,
I'm ready to go in that snow, man. Trust me.
Either way, guys, we want to take a second and say thank you to our healthcare workers and our essential workers who have done a fantastic job throughout this period, risking their own life and health to keep us all safe and nourished. We also want to send our best wishes to all those who have been impacted by the pandemic in any way. But for us, that is going to be it for today. Make sure you go ahead and get your mask down in the link in the description. Make sure you also follow and are subscribed or are subscribed to the podcast. So I'm going to give you a second to do that right now. If you haven't done that yet, come on, go ahead, do it. All right, you done? Good. We can keep it moving. So if you enjoyed today's episode, make sure you rate and review, as it helps our podcast tremendously. Also, make sure to follow us on Instagram and Facebook to be a part of our community there. But guys, this was a Problematic Cookout, and we're signing out. Peace.
Keep your mask on, guys. Be safe out there.